listeners are as important as our guests. Join in on the conversation. 504-341-8255, the New Orleans Talk Network. Our listeners are as important as our guests. Join in on the conversation. 504 listeners are as important as our guests. Join in on the conversation. 504-341-8255, the New Orleans Talk Network.
Hi, I'm Sheriff Joe Lapinto, and you are watching the New Orleans Talk Network.
This is Congressman Cedric Richmond, and you're watching the New Orleans Talk Network.
This is Bishop Samuel Blakes, and you're listening to Real Talk with Mary J.
Mary J. Thank you to all of my listening audience that are sharing with us all around the world. I hope you're having a happy Merry Monday today. We are having a happy Merry Monday. We are live in the studio on the great NOTN, NewOrleansTalkNetwork.com. We have been talking about fighting temptations, for a series. We've been dealing with part 1, 2, and 3, and we talked about fighting those temptations that will lead to those ugly places, those places of insecurities and all of that. But I am especially excited to celebrate on today because this is October, our Women's Health Awareness Month. And I have live in the studio with me today, Adrian Boutin. Welcome on the show today.
Thank you so much for having me.
I am happy to have you to share with us on today because we are talking about women's health.
Yes.
And you know that you are an expert when it comes to women's health.
Yes.
Adrian and I go way
back.
Huh?
Too far back. It's okay.
Too far back. Mm-hmm. Why don't you tell the people all over Radio Land and TV Land who you are and what you do?
Okay, listen, I'm happy to be here this morning, and God is so good. I must say that. I say it all the time everywhere I go, because God is just good. But for real talk, let's talk real.
Yes.
October is Breast Cancer Awareness Month across the United States, and many organizations, groups, schools are doing things that will promote breast cancer awareness. And that's what we want to focus on this morning. Breast cancer awareness, prevention, early detections. What are some of the things that African American can do in reference to reducing the incident and mortality rate of breast cancer?
All right. Now, Adrian, you didn't tell the people who you were.
Of course. I'm just a little shy and modest. But I am Adrian Boutin. I'm born here in New Orleans, Louisiana. My background as relates to breast cancer has been in public health. I have a bachelor's degree, a master's degree, LSMW, and I've coordinated breast and cervical cancer in Louisiana for years. Then I went over into public health, and we did all kinds of promotions to reduce the incident of breast cancer and other cancers in Louisiana. I'm also the co-director of my wonderful church, Greater St. Stephen's in New Orleans, where we help promote all health issues and awareness to our congregants there.
Yes, absolutely. And wonderful information, a wealth of information that Adrian can share with the public. So much. She has a wealth of information as it relates to breast cancer prevention. So let's talk about breast cancer prevention. We're in the month of October. Think pink. We're thinking pink, right? That's why we're wearing our pink today.
Yes.
And so let's talk about it because so many women fail to get their screenings. You know, so many women are not educated and not knowledgeable. We hear about October Breast Cancer Awareness Month, but not too many of us are actually taking the initiative to go and get our screening. Can we talk about that?
Yeah, and we can go back a little bit as it relates to families among African Americans.
Yes.
Historically, your grandparents, great grandparents used to consider cancer as the dead word that kills people, and many times families did not talk about cancer. They would even call it the C word in order not to talk about it, because the fear of that knowledge would perhaps cause someone to have cancer. So the consequence of not communicating, sharing with relatives, family history, you would have had grandmothers or uncles or aunts that actually died due to breast cancer, and other family members were not aware of it because it wasn't discussed. And that is one of the barriers to reducing cancer in our African American culture. And something that's interesting and surprising that many probably know but some don't know as it relates to communities. Among African Americans and Caucasian women, actually, I do this demonstration like this, very simple all the time, and trying to talk and relate the degrees. More Caucasian women develop breast cancer than African American women, Mary, but more African Americans die due to breast cancer in this United States. And why is that? And one of the barriers is because we don't talk about it. We don't know our family history. If there was breast cancer in your family, more than likely you need to do early detection early and more frequently. You need to be aware of your family history. You need to discuss who had what types of diseases, and not just breast cancer, but any disease. Because if one person in your family, close family member, had it, you are at risk for developing that same disease. So we need to talk about it. Make sure your children, your sisters and cousins know what diseases are impacting their family, and specifically we're talking about breast cancer. Another reason that we experience a higher incident of breast cancer is because of lack of awareness, not knowing, also access to care, which really means that you can't afford screening, you don't have insurance, or you're underinsured, and not having the opportunity to get to facilities that are qualified, that provide appropriate screenings for early detection and treatment. So because if you live in, let's say, Bossier City, and that's near Shreveport area. There's a lot of facilities there because LSU is out there with screening programs. But if you didn't have transportation to get to the facility or the hospital that provided screening, what do? You do nothing. And so you have a cancer that may be dormant in you and develops a larger degree that could be detrimental. And then not having transportation, not knowing, not having proper insurance, because you can go to the hospital for some diseases or treatment or care, but if you don't have the coverage for that particular illness that you're going through, it's almost like you're able to do nothing. So insurance is really, really a critical component in trying to make sure that we prevent cancer. And then the next thing I wanted to say about cancer, when some women, African American women, do go to get screening, more than likely in many cases it's at the late stage of diagnosis of their cancer. That is critical. That's critical, because early detection means that you're able to have your body screened, or a particular area screened early. That means getting it looked at and examined by the proper authorities, your healthcare provider, so that they can tell you if you have something or if you don't. And if they find that you do have a cancerous cell in your body, in your breast, then they can do x-ray, mammogram, some type of biopsy to determine the stage of growth of that cell, that cancer cell. And if it's caught early, like in first stage, there's different stages 1 to 4, then that means it's treatable. And treatable means that we can remove that cancer, destroy that cells, and you won't have any reoccurrence. But the later the stage of diagnosis is, and diagnosis is when it's identified, when they determine what that symptom, what that illness is, or that particular cell growth is. If it's abnormal and it's spreading, it's metastasized, means that it's moved from the original site to other organs in the body.
Wow.
That is really scary.
Yeah.
But late stage diagnosis with us, because if you're perhaps poor and you can't afford screening, you can't afford going to the doctor, sometimes you just don't have enough money to live every day.
Right.
And you have to make decisions. Have you heard of that, where people have to decide, am I going to pay my light bill this month?
All the time.
Am I going to get my medicine this month?
Yes.
So that becomes a serious barrier for women
Right.
or families that have to choose their health care
Right.
over the bills,
Yes,
or getting
yes,
food, or
yes.
transportation, or
Right.
some other family member that may be sick.
Right.
When you get late stage diagnosis of a cancer, that means your chances for survival really decrease, Mary. So it's important to promote what we're doing today, early detection.
That's
Early detection
right.
save lives.
Something that you mentioned too with the cancer spreading when it's not detected earlier on. That's an unfortunate thing that we would have
detrimental.
it and we can treat it if it's detected
Early,
earlier on.
early.
But then it spreads into the other parts of our bodies, and
Right.
now we're hearing that even men get breast cancer.
Yeah, and I'm glad you mentioned that, because I did want to say that among cancers in the United States, 1%, I think it's 1% of men develop breast
Right.
cancer from the screenings that not develop, have found to have cancer.
Yes.
Richard Roundtree from Shaft, do you remember that movie?
Yes.
Years and years ago.
Yes, I
that was
remember.
one actor that actually had breast cancer. So
Right.
men can get it, but the percentage is very, very low in men's ability or rate to get breast cancer.
Right, right. Well, I am so happy to have you on the
Thank
show,
you.
sharing with us this morning about breast cancer
pleasure.
prevention, to deal with those stages. You know, one, we know better, we do better. And I know we deal with the unfortunate of those who are poverty-stricken that may not have proper
Economic,
insurance,
socioeconomic.
that may not have the benefits, you
Yes.
know. But we're going to have to talk to them about what else can they do when they really don't, you know, if they don't have the insurance. Say, for instance, we have all of these people who may be in different homes and those type of outlets, homeless, that really
Yes.
don't have it.
Yes.
So what else? Are there any free clinics or any free treatments that you know of that we can
Yes.
offer the community?
Yes,
to share
well,
about?
one thing that we do have, we have American Cancer Society, and you can go to www.cancer.org and get all information, resources, details, where you can go to get screening. And there are many hospitals now that provide free breast cancer screening and mammographies for the populations, because we know, as I said earlier, one of the risk factors for developing breast cancer or identifying it at a late stage is socioeconomic level, being poor. And I thank God for President Obama, who tried to push and make sure that we were able to get care all over this country, medical and health care.
Yes.
But of course, there were some issues that occurred in his ability to get that done, where we would have had more access. But thank God we did get it in, and it has saved a lot of lives by having affordable health care.
And
that may be
Medicaid-
changing.
Medicaid is provided.
Yes,
so
yes.
Those that have
But in
Medicaid-
Louisiana, some of our ability to get more affordable screening was denied. So, but across the country, people now, because of affordable health care, do have access to care, and that has saved lives. But continually through the years, research is still indicating that African Americans are among the group that really experience more mortality or higher mortality than any other group in the United States. So what can we do about it? What can we do today to change those numbers or to change that reality? What do you think?
Yeah, we're going to talk about that, because I'm going to ask you what you think about that.
Okay,
what
that's
we can
good.
do right
Very
when we come
good.
back after this commercial break. We're going to talk about it. We're so glad to have Adrian Boutin on the show to share with us, because we're going to talk about those statistics and where we are and what we can do to make this thing right, especially for African Americans that are dying at a rapid stage to breast cancer.
Mm-hmm.
We'll be right back after this commercial. You tuned into Real Talk with Mary J, all the way from New Orleans TalkNetwork.com. I am your host, Mary J. Don't go anywhere. Stay right there. We'll be right back after this.
Very good.
Here at Jones Insurance, your full-service agency, let us take care of all your insurance needs. We provide homeowners insurance, flood, rental, commercial, auto, and life insurance. Don't let the unexpected tragedy destroy your family's future. Here at Jones Insurance, 7603 West Bank Expressway, Monroe, Louisiana, 772. Contact Lois at 504-348-1492.
Hi, I'm Prophetess Charlene Duforce,
And I'm Bishop Carol Dufour Sr.
and we're from Living Witnesses Ministries.
And we also have a program on the internet called Living by the Word Daily. And we're seen every Wednesday from 11 a.m. to 12 noon Central Time on the New Orleans Talk Network.
And we would like to invite you to tune in with us every Wednesday morning, again, 11 to 12 noon Central Daylight Time. Please join us as we teach the Word of God. Thank you, and God bless.
God bless you.
Listen up. Your customers, our listeners, could be hearing about your business right now. Yeah, right now. Don't miss out on the opportunity to advertise with NewOrleansTalkNetwork.com. Call our business department today at 504-475-4793 to hear about our great rates. NewOrleansTalkNetwork.com. We provide the people, you provide the business.
Hello, everybody. I hope you're having a happy, merry Monday. We're on Real Talk with Mary J. I am your host, Mary J. We're back from our commercial break with a beautiful Adrian Boutin that is sharing in the studio with us on today. I hope you're having a happy, merry Monday in Radio Land, TV Land, and all over social media land. Listen, we're talking about breast cancer awareness, breast cancer prevention. This is our Women's Health Month on Real Talk with Mary J. I will bring in a host of guests all month long to deal with all of these different subjects that women have experienced. I am so happy to have Adrian Boutin sharing with us as it relates to breast cancer prevention. So before the commercial break, Adrian, you spoke about how African American women are continuing to lose their lives because it's not detected earlier on. So what can we do to prevent these things from happening?
Okay, that's a great question. And although it's been said many times over and over, we have to continue to say it because even today, women are dying due to breast cancer, due to late stage diagnosis. What can we do? We can do several things. We may not be able to always prevent it because if you have a family history and if you already have that genetic predisposure to developing breast cancer, that's one thing. But early detection and prevention is another thing that can absolutely change your life. So what we recommend that lifestyle changes, that's a simple thing. That means eating right. If you're obese or overweight, you may want to consider trying to change that by losing weight, by eating properly. We're asking that and recommending that you eat more fruits. Everyone can eat more fruits, more vegetables. Stay away from the red meats. Try to think of plant-based diets. Plant-based, things that grow, that's natural, not necessarily the red meats that have a lot of chemicals in it that can cause cancer because of the cancer-causing agents that may be utilized in them to keep them from having diseases. But it impacts impacts our bodies. Also, we ask that people increase their physical activity on a daily basis or weekly basis. You may not be able to go to the gym every day or work out every day because you work or whatever, but you can do some things to move around more. Park your car at the end of the parking lot. Walk around the mall several times. Go in many stores as possible, like I like to do. You don't have to always spend money, but just to walk more, to ride cycles, to do ride bike cycling. Do many things that's going to cause you to not just vegetate, sit, and do nothing. We need to encourage our children, our family members, our neighbors, our co-workers to get active, get involved. I go to the gym pretty frequently when I can. You can do swimming, you can do exercising, you can do dance. There's dance groups. Those are all forms of exercise that will help us. Okay, then the next thing we want you to do is get regular screenings. Go to your doctor, your primary care provider every year. Get your health checkups. And they're not going to just check you for one thing, they'll check you for other things. But a part of that screening would be your breast exam, clinical breast exams that lead to a mammography exam if you have or they have detected some cancerous cell in your body. So those are some of the things. And talk about it. Spread the word. Have discussions. Have parties. Wherever you have groups. To make real talk.
That's a good idea.
Other environments where people are talking, let's talk about breast cancer. No longer are we afraid of the word cancer. Because there's been so many advances in the ability to detect cancer early. We have more scientific advances, we have better medicines, we have better treatment opportunities. So we need to let women know that they should not be afraid of a clinical breast exam or getting a mammogram. Let's talk about mammograms.
Right, because people always say, "Oh, it hurts so bad," and but I get my mammograms.
You do?
I've been getting them since I turned 40. I'm 51 now, so I've been getting them regularly, and it's not all of what people think. And this is a real kicker. Even if it hurts, wouldn't that be a lot less pain than if you had to go through cancer and
mastectomy, which is a removal of the breast tissue? So see that you just said something so important, even if it hurts. And that has been one of the barriers to women getting mammograms. They've heard, "Oh, girl, it hurts so bad. You're just going to die." No, you're not. You're going to live.
Exactly.
If there's a cancerous cell that they can identify.
Absolutely.
So can I do this little short demonstration? Okay, women who have not had mammograms and women who have had mammograms. The mammogram process is there's a clear plate, top and a clear plate in the bottom, and they ask you to press against this machine, and they're going to have these two plates come together and press your breast. Now they're not trying to make you uncomfortable in that particular technique. What it's trying to do is flatten the breast tissue so that the mammogram can detect anything in between those tissues that may be hiding something. So they're not trying to hurt you. They're just trying to get a good view so they can do a proper and appropriate screening on you. So women with heavier breasts, you may feel some discomfort, and sometimes it depends on the technician also now. And one thing I do suggest that if you're getting a mammogram and they're pressing your breast, if it's too uncomfortable, just tell your technician, this is hurting, and I'm sure she can make some adjustments. But realize that there will be some discomfort, but that's only for how many seconds?
And I'm glad you said discomfort, because that's all it really is.
It is.
It's a little discomfort because you're not used to having your breast to be suppressed.
Yes, absolutely.
It's not pain. I want to say that it's not painful. It's a little discomfort, and as you just said, if it's not comfortable, there can be some adjustments. Because there's been times where I put my arm and put my breast,
your head,
and it might pinch on the side a little bit, and I'll tell them in there, move you a certain way. But it's definitely necessary and it's definitely needed.
Yeah, and so you should communicate. Now, if it is uncomfortable, if it just has to be, it's only, you can count to 30, it'll be over. It's only for a few seconds, and that's a life-saving moment that you're giving your body, giving yourself the opportunity to find something that may be growing or may not be there. But at least you'll have the confidence to know, I did my mammograms and there was nothing there. If there is something, your provider will call you very shortly after that exam to let you know you need to come back in. We need another view. We thought we saw something. We thought we saw maybe it was a cyst. A cyst is not breast cancer. Many women have fibrocystic breasts. That does not mean that you have breast cancer. It just means that you have cysts and they need to re-examine you to make sure that nothing else is there.
That is so much information. You ladies out there, we have to make sure that we are aware, that we're in tune with our bodies, and we're taking the proper precautions to make sure that we know. You have to know your body. You have to know your body. So we're talking about early prevention, getting those screenings done earlier. Let's talk about some of the ways that they would know as it relates to just checking for the breast. What they need to do and how often and at what time should that be done.
Very good. And what Mary's talking about, very wise, is talking about knowing your body. She just said it. You need to know your body. So ladies, this is so simple. Anybody can do this. You probably do it and don't realize it. Once you shower, step out of the shower, go into a room where the mirror is, and look at your breast. If there's any significant breast changes in your breast, for instance, if one side is larger than the other, significantly larger, that's an indication that there's a problem. If one side is drooping longer than the other side, significantly, that's an indication of something's wrong. If there's discoloration, if there's lumps, of course, then that means something is wrong and you need to go to the doctor. But if you don't take the time to look and feel your breasts, then how will you know when something is changed? You need to know what those changes are. So you need to know your breast in a good state, and therefore if something bad is happening or unusual is happening, you're able to recognize and identify that and report it. Not just, can I give you a talk about, real talk, about an experience? This was years ago before we had the advances in medical technology that we do today. A friend of my mother had breast cancer. No one in the family knew she had breast cancer until it was far too late. She was top heavy. My mother went to her house one day and just walked into her bedroom, and in the basket in the bedroom was a basket full of bloody tissue, tissue paper. So what was happening is this lady unfortunately did not realize what was going on until it was too late, and she tried to cover it up by placing tissue in her bra every day, and not going to the doctor. When she finally went, it was, of course, advanced stage, and that cancer had metastasized, and she didn't live very long after that. We should never have to experience something where we're so afraid of our bodies or the signs that it's given us that we don't follow up with proper, appropriate medical care. So that's why Mary has me here and others here all month to talk about what we can do. We're responsible for our bodies, and we need to make wise decisions because God said our bodies are the temple of the Holy Ghost. So we are the caretakers of this temple, your temple, and there are things that you can do and you're responsible. So when you get late stage diagnosis, then you have to look at a number of things. Was I just not aware? Was I ignoring symptoms? Did I not have the opportunity to get screening? Did I not have funds? Just many factors. But because of shows like this, because of Mary's love for people and wanting to talk real, keeping it real, we're empowering you to go and take care and be knowledgeable about your own health.
Yeah, that is so interesting too. For you, she had bloody tissue, so her breast started bleeding?
I wasn't there. I'm just going by what I was a little kid at that time. But evidently leakage, there's leakage. You know, women have leaking. There's something, I don't know what else had gone on, but obviously it was a very late stage and the breast was deteriorating. So as graphic as that is, I hope that you will remember something like that to prompt you to go and not let the simple mammogram screening be a deterrent to you. Many women don't go for that just for that reason.
Wow.
No, that's
right. We're afraid of the unknown.
Afraid of everything, yeah.
Of the unknown, but knowledge is power.
Yes, it is.
And we're destroyed for a lack of knowledge. But not because we don't have it, it's because we reject the knowledge that we have. We don't want to. I hear women talk about all the time, Adrian, that they'd rather not know. Or they feel something happening with their body. They don't want to know. They don't want to go. So why wouldn't you want to go to have the knowledge, to empower yourself, to prevent whatever is happening?
Absolutely.
Because
Early
the
detection.
signals that happen in your body is an indicator to let you know something is not
wrong.
Right.
Absolutely.
Something is not right.
You're out of line with the order.
When we're talking about examining the breast, holding the arm up high behind your head and going from underneath the armpit,
right, and
all
that's
the way
called
from
breast
outside
self-exam.
to inside.
Right.
Exactly.
Breast self-examination. When the woman does her own breast, when she's feeling for something unusual, a lump in all areas, all around, up, that's a BSC. It's called breast self-exam.
Right.
When you go to your primary care provider, your nurse practitioner or nurses, they will do what's called a clinical breast exam. And that's where your caregiver provider is doing the breast exam. And if at any stage they feel something unusual, they will refer you for a mammogram.
Right.
So you can get a screening mammogram where you need to start primarily if you don't have a family history of breast cancer. The general recommendation is around 40, 42 to get your baseline. That means we know what you look like right now.
Yes.
And so when you come back in the next 3 years or 2 years or 5 years or next year, we can compare where you were to where you are, and they can measure and determine if there's any significant changes that will need to be addressed in another way.
Right, and that is so needful.
Yes,
to
absolutely.
just be able to do those self-examinations. My gynecologist tell me the first month, on the first of the month,
cycle.
After your cycle, the first day following your cycle, to do those exams. And you, like I said, being in tune with your body and knowing your body. Let me tell you something that happened with me. I do my breast self-examinations, and doing that, I felt that there was a knot in my chest, right? And when I felt that hardness in my chest, I was like, wait, this doesn't feel right, because I know my body and I know how my body feels. So, of course, I went in to have that clinical examination done. And my doctor said, well, I don't know what you're talking about. Where are you talking about? So when I said right here, she said, okay, now take your hand and go all the way on the other side. Do you feel the same thing there? And I was like, I do. She said, girl, that is muscle mass. Have you been working out? I said I have, but look, I was like, oh my God, I don't want to get, thank God it's muscle mass, but I don't want to be muscular, So I was like, okay, do I have to stop doing all of this? But yeah, we're getting ready to go into commercial break, you guys. Yes, but we're talking about breast cancer prevention, to understand your body, to be in tune with your body, and to know what's going on with you. Get that self-examination, then go in and do your regular treatments, your annual examinations, and those of us that are 40 and over, you need to really be checking your body out. Okay, we'll be right back after this. We're talking about breast cancer prevention on Real Talk with Mary J on today.
And I want to encourage you to join Church Without Walls every Monday morning from 11 a.m. to 12 noon.
And we want to encourage you to promote God's plan and not man's plan. Don't you dare miss it.
Hello, this is Dr. Glenda E. Williams.
This is Charles Stewart. Dr. Anthony Williams.
Are you looking for a home to live stream your next event? Give us a call here at Bethesda Community Event Center, the only place on a golf course that can host and broadcast live your wedding reception, your baby shower, business seminar, and any other special event. Give us a call at 504-708-9454 for more details.
Oh, how the time flies. What's up, y'all? It's your girl, Dr. Rhonda M. Lawson, And can you believe that it has been 1 year since Horizons with Meet the World Image Solutions hit your airwaves? We have interviewed authors, entrepreneurs, playwrights, musicians, and everyone in between, all to bring you the best of literary conversation. And we plan to do it again this year, but only better. So join us right here in the Literary Lounge each Wednesday night at 7 p.m. Central Standard Time, right here on the New Orleans Talk Network. See you there.
Now New Orleans has a choice. Download the New Orleans Talk Network app for your mobile device or listen at www.neworleanstalknetwork.com.
Hello everybody, we're back from our commercial break. We're having a happy Merry Monday on today. We're talking about breast cancer prevention. Are you aware of your body? Do you understand how your body functions? You have to be in tune with your body and know, feel on your body, touch your body, and understand that this is not something that is the norm. It haven't been there before, so that might be something that you need to check into. You need to have a closer look at that. So screenings are so important. We're on today's show with Adrian Boutin that is sharing with us. This woman of God has a wealth of knowledge, and she's just going to share with us as it relates to our breast cancer awareness, and those of us that have not taken the preventive measures. Let's deal with that on today. So Adrian, you were talking about before, there's so many people like through our bloodline that may have experienced some form of cancer. So when we understand that is so important for us to have early detection for that. Yeah.
Absolutely.
So many of our grandparents didn't talk about it.
Yeah. And that was really I don't understand it. Well, fear, and you said that earlier.
Yes.
Fear really destroys. Not real fear, it's just fear. Right. We want to classify it, but you must talk about your family history. And if you notice, when you do go into the doctors today, one of the questions they ask, family history. Did anyone in your family have cancer? Did they have diabetes? Did they have tuberculosis? Something like that. There's a list of things. You need to know that. I think one of the most embarrassing things is to find out 20 years later or 30 years later that you have a disease and your grandparent or your uncle had it. And when you find it out, then you'll say, well, why didn't somebody tell me I could have done early detection for this disease? So it is important to make sure that you are aware of your family's disease chart. Let's say that generations who had what, and then share that information with your current relatives or your children or your nieces. Or families need to talk about what grandma and grandpa had and what were they shoo-shooing about.
Right.
Because that was the way they communicated in those days, very limited. So one of the other things we want to talk about, I think you mentioned cervical cancer at some point. That's that is a women's disease. Very appropriate during this particular month, Women's Health on your show.
Right.
Many people may not realize that cervical cancer is a treatable disease. What that means is no woman should die due to cervical cancer. It's treatable. That means it's preventable. Women, I know of someone recently just passed from cervical cancer. It's such an unnecessary loss, because if you do regular pap smears as your doctor recommend, if there is any cancer there, pap smears can identify it early, at its earliest stage when it's treatable. But if you're not going regularly to get if you're sexually active, now if you're not sexually active, that's different. And most women that's over 21 are sexually active. And then if you have multiple partners, or you having sex with a partner who has multiple partners through his sexual activity, that puts you at high risk for developing what? HPV,
Yes.
human papilloma viruses.
Yes.
And there's many, over 100, about 100 different strands of the human papilloma virus. But about 10% of those strands actually can cause cervical cancer, particularly strand, I think it's 16 and 18, can cause cervical cancer. Now, there is a shot, a preventive shot that you can get when you're young. I think it's Gardasil.
Yeah, because they're doing it, I think they're starting the shot at age 13 now.
Right. They want you to, because there's so many strands in a human papilloma virus that causes some type of let's say infection or virus. The earlier you get that particular vaccination, the better off you will be. You reduce your risk for developing certain strands of the virus. So yes, they do recommend 13, I think even 12 at some age groups. But that's interesting. So that cervical cancer is treatable. Treatable means that if we detect it or before it's even identified, it can be cured. Cervical cancer, no woman should die, and that requires you simply getting a pap smear. Now, among women who practice a gay lifestyle, they have had fears of going to get gynecological exams because of the intimidation factor. They have to answer questions they're not comfortable with. So that's been a barrier for that particular segment of our society, not getting annual treatments. But no longer should we be afraid. Should we be afraid of examinations?
Especially our own bodies.
Yes. I mean, you're responsible for your body.
Right. Who should know your body better than yourselves? Right. And so many people, there's that myth that because you're talking about as it relates to our gay community, especially our women that are lesbians, that would think that because they're only having a partner that's a female,
same gender,
a woman, same gender partner, that they don't need to go get all of these examinations, and that is just a myth. That you do have to understand your body, because before you had that partners, you've had probably previous partners before that. So it's a history. But we definitely need to understand that.
Encourage women. And we really want our daughters, our cousins, our nieces to start early with early detection. We want them to make that a behavior change in their life. If they're not doing it, grow into it.
When I said 13 years old that they're checking for, that's serious. That's because I guess if it's detected early,
it's treatable in most cases. In many cases, if it's a cancer that can be cured and detected. So yes, you want to start that lifestyle change. You want to eat properly. You want to do physical activity, increase your physical activity. If you can't go to the gym, if you can't swim, work out, you can do something. There's so much available now on social media where you can be right in your home and practice exercising. That is so important. So we want to eat healthy, we want to be aware of our bodies, we want to increase our physical activities, and we also want to do annual examinations to make sure we're ahead of any disease that tries to attack our body, and talk about it as much as possible with others. Share the good news.
Yes, definitely. Adrian, will you let the people know different clinics that are available out there where they can go get an examination, where they can receive treatments? What outlets are available for them?
In New Orleans, we do have University Hospital, we have LSU, we have American Cancer Society, who also does referrals to where you can get cancer screenings in your area. Everything is not free. Some facilities may charge a fee or give you a prorated charge, but it's still worth it.
It definitely
and if you can't afford it, then you can call, and some of those facilities will make arrangements to help you get that at no cost to you. So yes, it is important to American Cancer Society. You can go to www.cancer.org and find out more information on where you can get screening in your area, free to the public.
That's wonderful news. Wonderful news. Okay, you guys, so there's a wealth of information, and you can go online. There's so much more information out there. Adrian has given you a whole lot on today as it relates to just understanding your body, doing the proper screenings that are necessary, understanding your history. If your mom has dealt with something, or someone in your family has dealt with some, or grandparents, you're able to understand that and have early detection to check your breast. Just check your breast every day. You know, when you wake up in the morning, if something is not feeling right in your body, that's an indication that something is going on in your body, okay? We're getting ready to go into commercial break. We don't want you to go anywhere. We want you to sit right there because there is more information right here on Real Talk with Mary J. Don't go anywhere. We'll be right back after this commercial break. Good information.
Listeners are as important as our guests. Join in on the conversation. 504-341-8255, the New Orleans Talk Network.
What's up, y'all? It's your girl, Dr. Rhonda M. Lawson. And can you believe that it has been 1 year since Horizons with Meet the World Image Solutions hit your airwaves? We have interviewed authors, entrepreneurs, playwrights, musicians, and everyone in between, all to bring you the best of literary conversation. And we plan to do it again this year, but only better. So join us right here in the Literary Lounge each Wednesday night at 7 p.m. Central Standard Time, right here on the New Orleans Talk Network. See you there.
We're back. Talk What You Know returns on Wednesday mornings at 8 a.m. We got a brand new co-host by the name of Bob B. And hey, that's me. Also, we got some new features. We're going to be giving away, have a weekly raffle of prizes. There are multiple ways for you to win, and there's a bevy of prizes. So we need you to come on back, join us on Wednesday mornings at 8 o'clock for Talk What You Know on the New Orleans Talk Network.
Now New Orleans has a choice. Download the New Orleans Talk Network app for your mobile device or listen at www.neworleanstalknetwork.com.
Happy Merry Mondays. It's your girl, Mary J. I want you to tune in with me to Real Talk with Mary J on New Orleans Talk Network every Monday morning at 10 a.m. Then follow me to blogtalkradio.com/Real Talk with Mary J at 10 p.m. It's going to be a Merry Monday every Monday at 10 a.m. and 10 p.m. You've just tuned into New Orleans Talk Network. Happy Hello, everybody. You tuned into Real Talk with Mary J, and we're back from our commercial break. We're talking about women's health all month long. We're dealing with breast cancer prevention on today with Adrian Boutin sharing with us in the studio today. I hope you all have been empowered and educated on today. Before we went in commercial break, we were talking about understanding early detection, knowing your body, being able to have that early prevention to stop those things from passing on from generation to generation. Don't be afraid to get a breast exam. And Adrian shared with some women that are afraid to have those mammograms. You have to be, and some of the nutrition
practice like that. And what does that mean? We've already this. Too many. Your outcome that are high with all kinds of choice. You need to eat right. You have a healthy life. Those that can't afford it, but we do it really. We actually drink a day at least. Exercises and men getting your annual exam.